Hi everyone, I'm Dr. Lin of Rehab and Revive Physical Therapy, and I have Stephanie here once again. We just saw her mini squats and how we can help her. So this is one of my first introductory exercises to get the patient's kneecap moving. We call it kneecap mobilization or patellar mobilization. And the purpose of the kneecap is such an important thing because it creates a fulcrum for our knee to be able to bend and straighten in a fluid way. A lot of people just think of the knee as a hinge, and that's not true to form because there is some level of rotation that has to go on. And we call this the lock home mechanism or screw home mechanism. The last 10-15 degrees, it starts rotating the femur and the tibia start rotating. So we want to get that hinge point free. So it's just like a door hinge. It's jammed. It doesn't move. We want to be able to assess it, then treat it right away. And so we're going to go ahead and take a look at her knees here in a second, and then go about it there. So why don't we take a look at Stephanie's knee tracking. This is one of the assessments as well as the mini squat. You can grab this pole, the outside, you can kind of feel it. It should hinge. Go ahead and straighten and bend it slowly. And what should happen here is this should actually lift away. The patellar lift is very important, so it creates space. Now, someone with dysfunction, you know how this could happen is sometimes the quads get really tight, they slam that down. Sometimes there's torsion because of the ankle, or the hip gets off axis, and eventually we'll talk about those things in other segments. But what should happen, and this is doing really nicely, is that she should be able to go straight. And there's no pressure here, no compression, no deviation going on. And if we want to do that, we're going to address that next. But let's take a look at this side. And we saw that this side had an interesting tracking with mini squat. And what I'm feeling here, and Stephanie can confirm, that it gets a little tighter right here. And if you take a look at this side, it just sucks right in. I was just feeling perhaps her quadriceps is getting tight. Maybe she's had a contusion there. Maybe she's fell on it. And the side effects of this being locked up for so long, you start getting ankle dysfunction, hip dysfunction, pelvis, back, your gait changes, people can start getting bunions. So those are the chain effects that can happen when these things get locked up. But what we want to do is address this right away. So you can see it gets a little tighter, right, Stephanie?
Yes.
And then that's what we want to do is be able to create motion. So what should happen also in a normal functional kneecap is as she extends, this should actually go up, and then as she comes down, this should go down. So it's going up pretty well, but it doesn't necessarily go down. So you could either do one or the other. You can either go ahead and compress right here. So this is the kneecap mobilization itself now. And what you can do is you could do in a static position, you could do that, but if it's too painful, the digression here is just to pump your ankle. Just pump your ankle, and you should feel that kick right into you. And so I would say kind of the cause for her dysfunction is probably a little bit of the quadriceps tightness. So you get a little stretch at the tendon here. And the really interesting mechanics of the quads, it becomes a quadriceps tendon, and it kind of envelops over the kneecap itself. Then it becomes that patellar ligament because it connects us down to the lower limb. And so keep doing that, and if it feels like it's getting looser, and it definitely looks like it's getting looser, your range should increase at the ankle, so you can really see how important that ankle is. And then the next thing is, then you could try to just push down and straighten your knee again. So go ahead and see if that flows a little better. Go ahead. And then, so that's good. And so what we're doing is we're trying to create the ability for it to slide and glide, and we're going to hold it right here, and yeah, so that way you guys get a better view. But this should really, when the angle you should push should be in line with your shin. Good. And then come back. Okay. So go ahead and straighten your knee again. And that's feeling less compressed, right?
Mm-hmm.
Yeah, and that's great. And she really can feel that. And then you could do different angles as you progress. I like doing either upwards. So sometimes if you're having issues going upwards, that's what you do. Use both hands. And she can feel at the very end, this helps with knee flexion. So she's having some issues there as well. And then when you push down, you're helping knee extension. So that's kind of a way to think about it. So we can reiterate, when you push down, you're going for knee extension. When you pull up, you're helping knee flexion. Those of you having trouble bending or straightening, you got to figure out what it is. Then you can try different angles that are tight. So you go ahead here, you can use opposite, Stephanie. Yep, and go that way and do straightening and bending as well. And once again, you know, if you're pulling up, you're going to help more flexion. If you're pulling and you're pushing down, you're going to help more extension. So that's like kind of the keys here to this exercise. Great, great, good. And she has, since I said, noted that this side was more compressed, we want to free that up. Good. Is it freeing up as you go on? Great, 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 great. So this will be interesting for us to watch the mini squat again. We'll do that in a second, and you can see that these are the hinge points that we want to touch upon. And you know, great introduction and low impact. You can do this at work while you're bored or you know, in class, and then, you know, get things better. So we just put Stephanie here up on the table. Want to check out that mini squat again. Pretty excited to see that. So let's go ahead and do some mini squats. I'm going to lower myself down here. And then, yeah, remember the whole goal, and refer to the other video of the mini squat, how she looked. She was doing some deviation, funny stuff on this left ankle. Looks like it's a little bit better controlled. Over your first and second toe, that middle of your kneecap. It looks pretty good. There we go. So what we want to do after this, you know, we've increased the ability to help tracking. The next subsequent segments, we're going to talk about certain exercises to help strengthen, gain control to the knee itself, and then go on from there, work above and below, like your ankle, hip joint. Those are really important things to get back on axis before we get started on, you know, the healing process and more strengthening. Good. Excellent. You going to always stop? Yeah. So, yeah, really appreciate you coming to this segment. Stephanie, thanks for coming in again. I'm Dr. Lin of Rehab and Revive Physical Therapy. If you're new to this segment or Rehab and Revive channel, please subscribe below. Leave a comment if you like it. If you don't like it, also leave a comment, and we'll do everything we can to help you out. Leave a like as well, and remember, we can and we will get better together.